Welcome to Grief is the New Normal. I'm Dr. Heather Taylor, a licensed psychologist and grief specialist, here to help change the conversation about grief and build community and connection while we all adjust to this new normal we are living in. This podcast is for you if you are grieving or if you are supporting someone in a season of grief. I'm glad you're here.
Welcome back, everyone. I am really looking forward to today's conversation. Joining us, we have Caitlyn Silverstein. She is a licensed clinical social worker, PMHC, certified clinical trauma professional, and some more letters that she's going to tell us about. Caitlyn, thank you so much for being here this morning.
Thank you for having me.
Do you mind introducing a bit about yourself and how you got into the work that you do?
So I am Caitlyn. I am a social worker by trade. So I started as a social worker in a busy New York City hospital, and I currently have a private practice specializing in maternal mental health, which includes a specialty in perinatal loss, grief, and bereavement, and also everything else along with motherhood, perinatal world. I started my career, like I said, in a very busy hospital. And I worked bedside with spinal cord injury, actually. So a different kind of grief, right? Like spinal cord injury, young people getting into serious accidents, or we had a lot of like gang fighting and things like that. So supporting them through that transition into the next level of care. And from there, I always knew I wanted to work in women's health, and a position had opened on the other side of the hospital in OB. So that was postpartum, labor and delivery, antepartum. So much of that work was social work, right? So we're talking psychosocial needs, but also perinatal loss was an aspect of some of the people that came through the labor and delivery unit.
Yeah.
And we also had a family planning clinic. So I had a lot of experience working hands-on with families that were going through a perinatal loss. I had cross-covered the social worker there, and she went on a leave for a few months. And so me and my coworker kind of co-ran that program. And we had a high volume of losses, I would say between 8 to 10 a week. So I really got like deep into that work starting from there. Yes. So from there, I did the same work at a Long Island hospital in New York. And I co-ran the perinatal loss program there as well and helped families come through with a perinatal loss directly at bedside. I did private practice on the side, and I opened my own actually a year ago today.
Congratulations!
Yes, thank you. So the last year I've had my own practice, and it has just been absolutely wonderful and amazing. And yeah, so that's a little bit about my start to this world of grief, loss with perinatal. Yeah.
And we know perinatal loss comes in layers, like we've got hopes, identity, milestones that never get reached. How do you describe this grief to people who haven't experienced it?
Yeah, so I would say that it's a grief that's really misunderstood. It's not highly recognized. It's disenfranchised grief, which is this grief that is not really heard about, spoken about. It's this grief with no place to go. And that makes it really complex for the families that are grieving this loss, because there is no place in the world for their grief because it's horrific, right? Nobody wants to imagine that this happens. And so when that happens, you're not able to speak about it, mourn about it, grieve out loud. It's tucked in a corner in a box. So that makes it really difficult. The other complex layer that makes the grief really complex and difficult is the fact that nobody else really knew the baby besides the mom, right?
Right.
So when we think about other grief and other loss in terms of, I'm just strictly talking about death here, because there's so much different type of grief, right? So we talk specifically about death, and we think about losing someone, we think about the memories associated, the items they had, the life they lived. And that is taken away from the experience of somebody who is pregnant, because they're the only person that really connected to that baby. So there's very limited items and mementos and things like that. And so that grief is really difficult. The memory of the baby and that experience and that grief is really done in silence and not widely shared.
Yeah. In grief work that I do, we talk about mementos and tangible things to be these transition objects that we can carry with us. I'm wearing my grandmother's bracelet, and that brings me a lot of comfort. When there's a stillbirth, or the baby only lives a couple days, there aren't those tangibles that we have, those mementos in the same way. That can make it hard to figure out, how do I carry this loss with me? Because I'm going to carry it inside of me. But what are those external representations for this life that mattered, that was going to take up space, and then it didn't go how we thought it was going to? And so there's these different layered griefs there.
Yeah, and that exact grief is the grief of what should have been.
Yeah.
And the first year is always the hardest because it's, I should have been X weeks, baby should have been X years old.
Yeah.
And so you're living through this future without that baby, and the milestones are just passing you by.
Yeah.
And it is very difficult for people to take that and hold it close, but also have difficulty sharing what they need in those times, because it's not widely seen. And even just like you're saying, like pictures and mementos and footprints, and these are all really special things. But sometimes there isn't a picture, and maybe it's just the sonogram. And so now how do you make that space for that in your home? Also not wanting to see it every day, maybe as a huge trigger for you, but also feeling like people do need to know about what happened to you and your baby.
Absolutely.
Yeah. It's really intense amount of grief and weight.
And so often we talk about leaning into loss, leaning into community when we're grieving. And this is such a vulnerable, tender space. And like you said, typically the one carrying the baby is the one who knew the baby. And it's hard to invite people into that story because it feels so personal. We feel so vulnerable. What would you say are some strategies you use to help your clients or couples to invite people into that lost space?
Yeah, so the first start of any sort of grief work that I do is assess the family and the client's understanding of their own grief process and how they may want to grieve. And so that may be really placed far on the back burner until people are ready to invite other people in. But what's also the double-edged sword here is that this grief can be so widely seen by the world. So for instance, what I mean is that you were pregnant and you went to work and then you're not anymore, right? So that idea of telling or sharing is taken away from you in that sort of circumstance. So those are the things I work with clients on, and how we integrate back into the world after this has happened, and how we personally want to share our story with the world, what we may or may not say. And that really becomes an unraveling with the client of what they feel safe sharing, what maybe their triggers, where their boundaries lie. Yeah. Because you may come back to work and people are like, oh, what happened to the baby? You had the baby? Right? And then what do you say? What do you say? You're standing there and you're triggered, and you don't get time to grieve. You don't get time off.
That was the thought that was going through my head, is like, I don't get my maternity leave.
No, it's terrible.
I get the 3 days of bereavement leave, and my body's been through this trauma. My soul is feeling ripped, and I have to.
You can get sometimes short-term disability.
Okay. Yeah, that makes sense.
Which gives a little bit of time. And it depends, right? Like you, either for mental health reasons but still you don't get any time to process. And this goes into this other complex idea that your body did have a baby, right? Your body is going to have these physiological effects afterwards, which is a lot of what I also talk about clients with who are fresh from the loss, is what your body might be experiencing afterwards. It's not just mental, it's completely a physiological change. And so you may be bleeding for a really long time, and you may be hormonal. And so these are all things that may happen to your body. And in any case, like, how are you supposed to go back to work and navigate the world then in this mental and physical shape? It's really unfathomable.
Overwhelming.
Yes, it's very difficult. And in general, when I talk about just like after the loss, right? And so we have friends, family that we may communicate with. And so what I like to say is tell one person from the area, right? You have your friends, you have your family, you might have this gym friends, you might have, these little pockets of people.
Right.
And so disseminate one person to tell whatever story you want to say. So you don't go back to work. So you don't see your friend group and all of a sudden everyone's invasively asking questions or ignoring you. Like you have this big stamp on your head and people don't want to touch you.
Right.
And yeah, it's very heavy, very difficult to navigate.
I think that's one of the complicated things about living in this grief phobic, grief illiterate society is when there is a perinatal loss, we don't know what to do. We don't want to make it worse, so we say nothing because it's our own discomfort in speaking to the loss and acknowledging and even just saying hi. Because, oh my gosh, if I say hi, are they just going to start crying? And I don't know what to do with that. And maybe we're at work, maybe we're at the grocery store, maybe we're at the gym. Like, when really it's like we're thinking about it already. We're thinking about it all the time. And we want to be seen and acknowledged in our pain and in our grief. And so it's, how do you help our clients to kind of reclaim that grief space for themselves?
Yeah, exactly what you're speaking to is this internal rage that comes up where you just want to scream to people like, this is what happened to me. And you're walking around with this heavy thing and it feels suffocating. So in terms of wanting to share, I would say that we do need to allow people to try their best, and we could be angry about how they do that. And we also need to take control of the narrative about what we want to say and what we are ready for and not ready for in terms of conversation. Talking about loss with other people around you is a main point of the work that I do with clients specifically, is around what you want to say, how you want to say it, who wants to know, who doesn't want to know, taking control of the narrative. And exactly what you're saying, like you are walking around desperate for someone to mention your baby and no one is saying anything to you because they're scared of whatever they're scared of. And that's really not on the griever, it's on society to do a better job. But what I would really say is that you need to not be afraid to share what happened in a concise way. So usually what I do is I work with clients on creating 1 or 2 lines that they could say and just repeating it, right? Whatever they feel comfortable with. It, and some of it might be just, we lost the baby. Thank you for your thoughts.
Yeah.
The baby didn't make it. Appreciate your words. Or saying, or maybe some of it's challenging them, right? Somebody might say to you, well, at least you weren't that far along. And so a client might say back, it doesn't matter how far along I was. This is my baby and my baby died. Right?
Yeah.
So what is the other person supposed to say about that?
Snap, crackle, pop. I love,
yes.
like, yes. Clap back.
Yes. And but this takes a very long time in working with clients to develop that sense of internal self and ability to do so. For instance, you might go to a supermarket and you might be talking to the cashier and they might say to you, oh, how many kids do you have? And so in the first few months of grieving, you might say none, right? If you don't have any other children. In the 6 months to a year after, you might say, I have a son, but he died and he's in heaven, or whatever the client feels comfortable sharing.
Sure.
Or you might just say, I have one. And that you might not cry after that. The first time you do it, you might cry hysterically to the cashier. The second time you might say, wow, I was able to get through that and share that.
Yeah.
But sometimes not acknowledging it too is really reaffirms that this should be a shameful thing. And so I really work very hard on letting people know their grief matters, their baby matters. And that's a very confusing thing for people to understand, that their baby matters, no matter what gestational age, because they were taught like, whatever, move on, just try again, like you'll have another one.
For sure.
All these internalized like thoughts.
All these microaggressions.
Yes.
and minimizing narratives that
Yes.
speak to the other person's discomfort with grief and actually don't have anything to do with you and your loss. It's their own discomfort. And yet we wear that. It's this thing that we shouldn't talk about when really it's no, like you said, our baby mattered.
And I think understanding that your baby did matter and challenging those narratives around what people say about your grief is really something that you need to work on after you lose a baby.
So, you work with individuals and families in the aftermath of perinatal loss. What are some of the emotional, physical, or even identity-based grief reactions that show up?
So I'd say the most common is guilt. Why did I know? Why didn't I do something? Why did my body let me do this? Like, how did this happen? What could I have done differently? Why did I do this? Why did I do that? So a lot of guilt because it happened within your being, right? And so that feels like I did something.
Yeah.
And so changing that narrative to this happens and this happened to you. And we need to understand that there was nothing that you did that caused this or created this. And they'll say, but I lifted this, or I did this, or I did that, or I didn't. No. I always say, if you truly had control, truly did, and you had the ability to cause or not cause this, you would have not caused this, and this never would have happened. There's absolutely no way that you had control over this.
Yeah.
So we do a lot of challenging there, and deep anger and rage. Anger, frustration, and it comes out in so many triggers. Your friend tells you you're pregnant, you're passing a stroller, you hear a baby cry. Anger. Why me? Why us? We're so good. We're such good people. Like, why did this happen to us? All these other people have babies and they might not be a good mom, or they might do X, Y, and Z. Why us? We have everything for this baby. We're so excited. We want this baby so deeply. And then isolation, loneliness. This is lonely. It's isolating. It's scary. It's also this heaviness of I now have to live with this.
Yeah.
Then what comes next? And who am I? Because am I a mother? And I'm talking about strictly people that don't have other children. It's very difficult for them to feel like a mother. Am I a mother? Where is the place for me in this world? Am I a mom or am I not a mom? There's no place for people who are moms without a living child in society. So we do a lot of work around reframing that, like, you are a mother and you need to reclaim this baby as your child, which is very difficult to do and very deep, like pain, aching. Like, this work is really intense.
Absolutely.
But we have to get to the nitty gritty. We can't just push this away. We have to dive in deep to all those emotions in order to properly process and properly understand how to properly move forward in a way that you can smile again, you can laugh.
Yeah.
Those kind of things.
It's figuring out, how do I come up for air?
Yes.
When I've been down so deep in that grief space.
Yeah.
And I love what you were saying about the rage, the anger. I call anger spicy grief.
I love that.
Because it's true, right? Like, you need to metabolize it out, talk about it. And especially, I think, as someone who identifies as female, I was raised that anger is bad. Anger, I can't be angry. I have to be nice and kind. And otherwise I'm bad if I'm angry. And so I think a lot of other women were raised in similar fashion, in that anger is bad. And so to empower them in this vulnerable space, I think, is such important work, that, like, it's okay to be angry about the situation, at yourself, at your body, and then finding how to move through that to what's on the other side, I think is such important, powerful work.
I really just share that it's exactly that experience. You have this weight on you, right? And you don't know what to do with this weight. And so I say, share the weight with me. We will work through it and we will carry it together until you're able to carry it on your own. Because you do need to, if we're thinking about it like a luggage, some people want to just put the luggage in the corner, like never see it again, never travel with it, never use it again. That's not helpful at all. We need to actually take it and we need to carry it with us because it's there anyway.
Yeah.
Whether you really want to acknowledge it or not, it's there, it happened. And so you really do need to take that on and understand that that isn't scary. It's hurtful and it's painful. But we can like slowly start to do that work of moving through it together. Exactly. And not moving on. There's no moving on. It's moving through.
It's moving through. Yes.
And it's integrating. So what I say to clients, and I'm sure you've heard this analogy, like grief is you wake up one day and the world, everyone's speaking a different language. And so you'd have no idea what people are saying. The world seems crazy to navigate. You don't know where to go. You don't know what to do. You're in a brand new place, new language. And how do you move through that and learn and integrate? And so I talk a lot about integration in terms of grief, right? How do we make it part of us? Start to learn the language.
Absolutely. Yeah. There's this great graphic that's gone around on Instagram, and it's grief originally. It's like this giant garbage bag, and it takes 2 hands to hold and carry. It's super awkward. It's bulky. It gets in the way of things. And then over time, as we integrate, maybe it becomes a briefcase size thing of grief. Still takes a hand to carry. It's a little more contained, but you're still carrying it with you. And then eventually, once there's full integration, it becomes like a crossbody bag. So both hands are free, but it's still on you. It's still with you. You're still carrying it with you. And I think that's such an important thing to honor in the grieving process is, again, grief doesn't go away. It just gets different. And we learn to carry it in different ways through different seasons. And I think with perinatal loss, especially if we had other people who were pregnant at the same time around us, we're watching their kids hit those different milestones. They would have been walking. They would have started kindergarten. They would have graduated. Like, these losses are going to come up, and without processing, without integration, it's like they're going to knock us out in a very different way that keeps us from moving through in a way where there's space for that honoring that I could have been walking through these same milestones, and I can be grieving and sad that my child isn't here to experience that, and grateful for the time I did get to have them in my body and with me. And it's complicated, but we have to have that integration piece, because again, the grief, it's still going to be there. We can't just shove it in the closet under the stairs and let the luggage pile up, and that doesn't work.
So there is a grief model that I use almost every single time with all my clients, and it's from Lois, Tonkin. She's a grief counselor, and she has a beautiful graphic that I will share with you that she created. So this is how I like to share grief. One day you have your piece of paper, right? And you are this square.
For listeners, Caitlyn is holding up a small square of paper, and you can watch this visual on YouTube, and I'll make sure we make a clip of this so I can share this specific part on Instagram for our audio listeners.
Perfect. Yeah. Thank you. All right. So we have a square piece of paper, and you're the square, right? So the first day of grief, your grief is a very big circle. So it's like this. So I have the square paper with a circle in the middle. The circle is taking up every single space. So I say that this is your grief. Your grief is the circle in the first few months, right? It is touching every part of you. It is all encompassing. It is completely painful. It hits all the sides. Okay. And when you start to grieve properly with hopefully a therapist to process, your grief actually will stay the same. It'll stay the same size. And I don't have a bigger piece of paper here. Let's just use this, for example. And what happens is your grief stays the same, but you become bigger and you start to grow around the grief. So what happens is with this piece of paper that you become, which is bigger, your grief will just slowly start to move. So one day it hits the side, it hurts. 2 days go by, you don't cry, hits the side. A few days go by, hits the side, right? So over time, you actually grow around the grief, right? The grief doesn't change size. It more so, you just grow around it, you integrate. And so there'll be days that the grief will really be hurting. And those are those crashes, right? When we say grief is like a wave.
Yeah.
It'll crash into you.
Call them grief bursts.
Grief bursts. I love that.
Yes.
It'll crash into you and you'll be brought back to that day, right? But then a day will go by and your grief will be here, right? And you'll notice it. You'll know it's there, but it's not banging into you painfully. And this is what happens when you properly integrate your grief.
Yeah.
It's there, doesn't change size. And I love this because a lot of people do have difficulty understanding that this happened and that they need to grieve this versus pushing it away. So what happens if we don't integrate? It's going to hit all the sides. It's going to come out in ways that you don't want it to, right? Anger, depression, anxiety, snapping at people. You may not eat, you may not sleep. So you're not going to be able to move from this to this really big piece of paper. So that's the theory of grief.
That's such a great visual. I love it. Makes me think of, I don't know if you guys watch The Office, but when they're watching the old school TV and they're watching the little icon float across, trying to like land perfectly in the corners. But I love that as a visual, that it's that circle of grief moving around inside of you. And it just, when we have those bursts, it can be days between those. And that's just when it's hit one of those sides or a different aspect of self. Thank you, Lois Tonkin.
Yes, it's really helpful for people understanding something tangible.
Yeah.
It's really hard for people to understand, like, why do I need to feel this? Why do I need to feel the pain? And so I say it's there. Are you willing to bring it up to the surface to have a better experience moving through it?
Yeah.
Because then we get PTSD and prolonged grief. And so people will say, they're really depressed. And I'm like, yeah, wouldn't you be depressed? Anyone would be depressed over this. This is depressing. It's upsetting. Like, it's okay.
We have to understand it and explore it. I say with my clients all the time, you can't tame it till you name it. And so it's like, we have to bring those feelings up so we can understand them, so we can integrate and move through.
Yes.
Yes. This is part of our story. This is part of our lived experience. It's not something to hide away. It's identity impactful.
Yeah. And a lot of it is, why do I have to do this? Why do I have to accept this happened?
I don't think it's that we have to accept it. We have to acknowledge that it happened and understand our reaction to it happening, but we don't ever have to be okay with the fact that it happened.
Yes, and I think you're talking about a really great point here is the word acceptance. Some people think accepting it means that I'm allowing it, I'm approving it, I'm giving it like a big check mark. Yes, I agree with it. And exactly what you're saying. It's not about that type of acceptance. It's about more of this awareness and bringing it to our conscience that, yes, this actually did happen. And so more so like the reality. And now just understanding that this process did happen. And now where do we go?
Absolutely.
Yeah.
So in that vein, this is a lot for individuals to process on their own. How do you hold space, not just for birthing people, but for partners or family members who are also grieving in very different ways?
Yeah, it's a great point. A lot of couples have difficulty with the way that each other may be grieving, right? So I like to talk about cultural and gender norms and expectations around grief. For instance, you might have I'm just talking a heterosexual couple, male and female, right? The female went through a pregnancy loss. The male doesn't know what to do. He doesn't want to talk about it because he doesn't want to upset her. So then he doesn't talk about it. Then she sees it like, why aren't you talking about it? Why aren't you asking me? Why aren't you checking in? And he's like, I don't want to upset you. And then he might be going off with his friends. He might be going out. He might be going to the gym so much. He might be out back chopping wood and creating some sort of, I don't know, structure of sorts to get his energy out, or working on a car, or he might be doing that kind of thing. And really bringing awareness that actually is grief and you're grieving in different ways. But the problem becomes when you don't communicate. And when you expect one party to maybe hold the grief, to hold the memories, to continue on the legacy, and then the other partner doesn't buy into that. That's where I feel most discord happens. And it's that very gender norm aspect of the male is going to be a protector of the family, and he's going to take care of and do. And so that role really gets amplified by tenfold plus with this type of grief, because he sees his wife grieving and his partner grieving and loss, and he doesn't know necessarily how to deal with that, and doesn't and is scared of if he breaks down and she breaks down, then who's going to hold things together? I'm just strictly talking from that. But the other aspect is like grandparents. I'm talking about grandparents of the baby that passed, right? They're doing two different layers of grief. They're grieving for their child and they're feeling the pain of their own child experiencing this and wanting to take all that away. And they're also grieving their grandchild. And that is double layered.
Yeah.
So yeah, just making sure that everybody communicates and does a little touch point weekly and check-ins with each other. And really making sure that everybody's on the same page on how we might want to remember this loss too.
That leads into the next question beautifully. What would you say are some rituals or practices that you found meaningful or helpful for clients to honor their baby in their grief?
Yeah, so we always know funerals and some celebration of life, those types of things are really helpful for people. Headstones, having a place to go in terms of like where you're going to grieve and where you're going to have a special place. And if sometimes that's not always possible. So I would say carving out a space that you have in your house or in your backyard for this baby. So even if that's not possible, then we're talking things like planting a tree, planting flowers, making a rock garden, which I really like to have clients with other children do because then they can paint rocks and the rocks don't really go away. And each year on different things they could add to the rock garden. So that, and any mementos that you might have during the pregnancy of the baby, getting a really special box for all those items, because then you can choose what you feel like you want to display or not around your house. Etsy has a ton of great resources for different pictures and memory making and things like that for babies who have passed. I like that as a resource. And I think symbols are really helpful. It could be a nature symbol and connecting that spiritually. So when you do see that symbol, it reminds you that is my child and speaking to me in this way. Then you might notice that this symbol does show up more, right? All of a sudden you're thinking about ladybugs and they're everywhere, right?
Yeah.
So
sure.
Connecting beyond the physical.
That's so great. You have an active social media presence. So how do you find using social media as a tool for grief education and connection, especially in this space where people often feel really alone?
Yeah, I think the most important part is making space for this loss and knowing that there are communities that are based on social media for this loss. And so I do a lot of infographics and things like that because sometimes people don't know what to say or how to say it, or they might feel like, oh, I'm thinking this one crazy thing. Then they can go to a page like mine and say, oh, wait, no, that's okay that I'm thinking that way.
Yeah.
And just bringing this into the existence of the world, and then also having a safe place for people to feel some of these feelings, share some of these thoughts, and have this like little corner that connects people.
Yes, there's pros and cons of social media. And with this grief piece, it helps connect us with others who speak the language of loss, who speak that griefy language, who understand that lived experience. And that can be so normalizing and validating, regardless of what community you geographically live in. And I think there's a lot of power and empowerment within that.
Yes, totally. And just seeing, oh, wow, like I'm not crazy. Like these are normal feelings, or maybe I'll save this and this is something I should share with my partner, or, oh, just feeling seen.
Yes.
Yeah. And the providers, like, there's not many providers that can do this in a way that's safe for the client. And if I can be a source of information for other providers, that is very special.
Yeah.
That is really the work right there.
Absolutely.
Yeah.
So, Caitlyn, as we start to wrap up this conversation, what would you say to someone listening who's recently experienced a perinatal loss and is deep in that raw grief space? What would you want them to hear from you today?
So I would definitely want to share that it's not their fault, that they did nothing to cause this to happen, despite what their brain might be telling them. I know they did nothing. And like I said, that if they really had control, then this would have never happened.
Yeah.
So I want that to be a sticking point. The other thing is that this is common and you're not alone. 1 in 4 women will experience a perinatal loss. It's just not talked about. So I bet if you feel like you are able to, in some point, connect with somebody, you might feel more comfortable starting to share your story because it deserves to be heard and your grief is so valid. No matter what people say about the gestational age or however, whatever happened, your baby was still a baby. You still had an imagined future. You still have to grieve this experience and kind of think about next steps for you too.
Yeah.
And so this deserves space and you deserve to work through this.
Thank you so much. So,
Yeah.
Caitlyn, this was such a great conversation. If listeners are interested in following you on social media or connecting with you, what are the best ways for people to connect with you?
Yeah, so they can connect with me on social media. So my Instagram is my name. So Caitlin, Caitlyn Silverstein, Silverstein, LCSW. And then you could also, I have a website, same name. So www.CaitlynSilversteinLCSW.com. So potential clients or anyone wants to connect with me, Instagram's a really great way to get some information around perinatal loss and to be seen. And then further, if you're interested in therapy services, I have a free intro call on my website to book. And that is pretty much the main way. I'm pretty active on social media. That's the main way that people can follow me. I do have a TikTok as well with my same name.
Awesome. Caitlyn, thank you so much for taking the time. This was such a powerful conversation, and I just so appreciate your perspective and giving more light to this type of loss.
Thank you. I'm so happy that I was able to be here and share a little bit about this part of my world.
Listeners, remember to be kind to yourselves. We'll see you next time. Take care.
That's it for today's episode of Grief is the New Normal. If this conversation resonated with you or you think it might benefit someone else, please share it. Sharing can open doors to healing, understanding, and normalizing these griefy conversations. If you're craving deeper insights or ongoing support, consider signing up for the Grief Gap newsletter. It's packed with resources, tips, and personal stories to help you navigate your grief journey. Visit the website www.griefisthenewnormal.com to subscribe. For those who prefer a more personal touch to their healing process, check out my grief journal, Authentically Unapologetic. It's designed to help you explore your grief on your own terms with prompts and exercises that encourage reflection and growth. I'm Dr. Heather Taylor, and I look forward to our next meaningful conversation. Our soothing tunes are provided by the Datacorns. If you're interested in sharing your story, collaborating, or learning more, please email me at hello@griefisthenewnormal.com. You can also stream the episodes on YouTube for more engaging content. Until next time, keep exploring your grief with intention and support, remembering you don't have to do this alone.